my laboratory has been very interested in trying to discover biomarkers, serum biomarkers, that could predict who's going to do well after graft-versus-host disease and who won't do well. So who could use less intensive therapy or more intensive therapy. And we've discovered several biomarkers that could fit the bill. We actually have created a group of transplant centers called MAGIC, the Mount Sinai Acute GVHD International Consortium. And we monitor about 800 allogeneic transplant patients per year to see how many get graft-versus-host disease and what their response to treatment is and how long they survive. And very importantly, every time a patient gets graft-versus-host disease, they provide a blood sample, both at the onset of treatment and then for several weeks thereafter. So we've now done a study looking at actually about 600 patients with graft-versus-host disease. And we compared the response to treatment after 4 weeks, which is the gold standard for all clinical trials that currently exist. And we compared those clinical responses to the serum biomarkers that were taken at the same time as the clinical responses were recorded. And what we found was that 2 biomarkers that we've discovered can be placed into an equation. The concentration of those 2 biomarkers are put into a computer, and we get at the other end of the computer program a single number. And that gives us the probability of mortality. And we call this the MAGIC algorithm probability, or MAP. And when a MAP is low, the patient has a very low chance of dying from graft-versus-host disease. When it's intermediate, they have an intermediate risk, and when it's high, they have a high risk. So when we looked at all patients 4 weeks after therapy, systemic therapy for acute graft-versus-host disease, what we found was that the clinical responses were good, but not great, at predicting long-term outcome, where the biomarker, the MAP, was significantly better. And we could look at patients who had both a response to therapy and who didn't respond to therapy, and this serum biomarker probability could classify both sets of patients accurately and tell us in the patients who didn't respond, who would be at high risk, actually the majority of them were at low risk and had a much better survival than the patients who had a biomarker probability profile that was high risk. So we looked at this at 1 week after therapy and 2 weeks after therapy and 4 weeks after therapy. And at every time point that we tested, the biomarkers were better than the clinical responses. So we now believe that we have a better clinical trial endpoint for clinical trials of treatment of acute graft-versus-host disease than the standard clinical responses.